Good afternoon, New Mexico. It's Governor Michelle Lujan Grisham, and thank you very much for joining us for our weekly COVID update. I appreciate that you tune in and talk to us about things that we can improve and getting the latest information about how we're doing as a state. I want to highlight this incredibly beautiful mask that was made for me by Monica Salter Williams. Monica, thank you very much. It's incredible. And as we do every time, I'm going to take it off so that people can hear me, and then we'll put them back on as each of the presenters does their part of the press conference. So let's go to the first slide, which is our case update. We have 161 new cases today. That brings our total to 26,429. I'm going to steal a little bit of Dr. Grace's thunder, potentially, which is our rolling 7-day average is at its lowest point since, I'm going to say, mid-March. So that is incredibly good news. But at 161, we really want to see these cases stay at right about 100. Or frankly, I'd love to have 0 cases. Congratulations to the Navajo Nation who reported that, I think, yesterday. But we're not panicked by this number, but it is something that we will continue to watch carefully. Hospitalizations, we still are seeing a downward trend in hospitalizations. That's good news. We have 80 currently, 15 on ventilators. Thing to know about that, if this is the first time you're viewing, is we want to make sure that our hospital capacity isn't being stretched by the number of individuals who require not just COVID, but require hospital care. Unfortunately, we have 3 new deaths today. We have, and of the 3, we've got a younger person in her 20s, underlying conditions, but I highlight that only because this is a deadly virus, and it does not care about your age. And it is something that, given the number of cases that you will see in some of the modeling, I also believe, in terms of younger populations who continue often to lead the number of daily infections, it's an important thing to note, right, that this virus is blind to those issues. We have 816 total deaths in the state, and again, our condolences. These are really painful to talk about, painful for the entire country, given that our mortality rates are absolutely unacceptable, and it does very little to console or support the families and loved ones who are still reeling from their grief. We have done 806,999 total tests. We continue to be right in our gating criteria for tests, although we're down a little, and I expect that to get right back where it needs to be at those 5,000 tests per day. So thank you very much. And with that, I'm going to stop stealing your thunder, Dr. Grace, but in fact have you do the public health scientific modeling data for us.
Thank you very much, Governor, and appreciate being back. First, just wanted to start by congratulating New Mexicans. We don't get the best numbers we've had in 4 to 6 months unless people are staying at home, they're wearing their masks, they're not going to large gatherings, and they're, keeping surfaces in their hands clean multiple times a day. So thank you for that. We'll go right to the first slide, which is if you've been watching any of these, you're familiar with the top blue dotted line is the sum total of the 7-day average of daily COVID positive cases. Just a reminder, no matter how many positive tests a person has, we only count them once in this count. And you can see that we continue to trail off. There's a little bit of data lag because we categorize these cases per day by the date they had the test done, which is a little different than what you get if you're keeping your own spreadsheet, which people do on the press conference data. But a little bit of a lag. We're at 101, great number to be at, best we've been at in a really long time. And then below that, the solid lines are the different regions. And Governor already pointed out that orange line there, the Southwest, doing very, very well. And if I squint, I think they might be the lowest number of case region of the 5 regions in the state over the past day or two. So amazing recovery there. Lots of compliance with masking and all the other things we know that help reduce the spread of COVID from person to person, which is how it gets transmitted. Let's go to the next slide. These are what we call heat maps. There's two of them on the left. This is the total number of cases by county as of yesterday. I was told today, and I've been holding out for Debaca County for a really, really long time here. I was told today they had their very first case, so this is yesterday's data, but still doing a great job out in Debaca with only one case. So it was going to happen sooner or later, but great job keeping it down to just one. But you can see that if you look over the entire pandemic in New Mexico, you can see McKinley County up there in dark red, San Juan. The darker the color, the more the cases. Bernalillo, of course, with the most. And the top four remain Bernalillo, McKinley, San Juan, and Doña Ana in that order. But we're seeing more activity in the south. I do want a little trivia point. Today is COVID day 184, which means that yesterday was day 183. And 183 is exactly half of a leap year. And so we have made it 6 months. We're into our second 6 months, and hopefully there won't be too many more 6-month periods after that. Might be half of one or so, but we're making great progress. Now the map on the right just focuses on the number of cases in the last 2 weeks, again by test date, which is how we do it. And you can see that now the Northwest is kind of fading in those darker colors and the reds. We're seeing in Chavez, Lee, Eddy, Doña Ana counties with some activity in Curry, a little bit of a downward trend in Roosevelt, but still cases there. So watching that closely and monitoring. This next slide is a new one. This is for members of the press in particular and legislators. We've gotten a lot of questions about recovered cases and active cases, and in theory, you have the people who are still susceptible, the people who have active COVID infections, and the people who are recovered. Epidemiology was doing their best to keep up with our 25,000 plus cases and contact every single person to find out whether they were fully recovered. But we've changed the way of thinking about this, and in an effort to be responsive to public requests for more data, here's what we came up with. So first, that green shaded area on the bottom is by day, we add up all the cases for that day and the previous 13 days. So, and why do we pick that 14-day period? Well, because COVID is generally infectious for 10 to 14 days, and we just wanted to do something simple. We didn't want to start adding and subtracting and multiplying and dividing around people who died from COVID, people who are in the hospital, people on ventilators who might have a longer course. And so we just said, the average person with COVID has COVID for 14 days, and you can see that somewhere there in the middle of July on the graph, on the green graph now we're looking at, we peaked at about 4,800 active cases, 4,800 people in a given day who probably were able to infect other people with COVID. The red part on top is actually some really good news. It's a bigger part of the curve, but according to our modeling data that reflects calculations we do based on deaths and hospitalizations mostly, for every case in New Mexico that we diagnose with a test, there are 3.4 additional tests, additional cases. 3.4 people out there with COVID who haven't been tested, probably not having as many symptoms, but still, as we know now, just as infectious. And so, and the 3.4 number is a great number. If you remember 6-8 weeks ago at a press conference, I told you about a report from the CDC estimating that for every positive case, there were 8 to 25 additional cases in a community. We believe our number and our ratio is so low because of all the testing we do and how fully we've embraced and carried out good testing. Other thing one of the senators asked me to remind people of is about the reliability of the testing we do. We still do lab bench tests looking for RNA virus. That's the most sensitive and specific test. Those are technical terms, but I think a simpler term is how accurate are these tests? They're 98% accurate. All of the other tests that you hear about and that maybe you might get in that are on a folding card or something like that are not anywhere near as accurate. So we feel really good about that ratio. But the interesting part of this graph, and it even surprised me a little, as you can see also toward the middle end of July when we're having 300 and some cases a day, we actually had 20,000 people in New Mexico at one time who could have transmitted COVID to others. So I think for those in the press who asked about this, you could take this number at the top of the red, because the top of the red is the sum of red and green, and you could say those are the active cases, and the recovered cases are just the total cases, that 25,000 and some number, minus the cases we've got here. So hopefully we can use this going forward. I don't know if I'll present it every week, but as you can see, it follows very closely the case curve, because that's what it's based on. Next slide, I want to just provide additional encouragement to people about delaying, stopping any delays you may have in healthcare. It's very understandable, particularly when healthcare facilities were closed in March and April, that we saw a serious drop-off, particularly in preventative services. But I wanted to highlight breast cancer today. For women, it's the second most common cancer in the United States for women after skin cancer. In the last year, we had data available, 2017. For every 100,000 women, there's 125 new cases, 20 deaths. And so we had 9,261 breast cancer cases in New Mexico. And so I know some of my patients have put off getting their mammograms. And there are a couple concerns about putting off needed care. Number one, your health, and the fact that these screenings have been proven to be effective in early identification of disease, which means earlier treatment, which means much better outcomes. But also the cost of care and the complexity of care goes way up. An early stage breast cancer, if discovered through screening mammogram, can be treated simply with one or two modes of treatment, like surgery, radiation. But once you get into more advanced cancers, then you need chemo as well, or three modes of treatment. So this is actually data from New Mexico, from some of our hub hospitals who are now providing this data to show these trends. It's great to see that it came back up in July, but there's that divot there of all those missing mammograms. And so this week we're really encouraging women to, if you have not made that appointment, if you know you're overdue, pick up the phone today, tomorrow, call and make that appointment. It's safe. People know how to implement COVID-safe practices in healthcare systems. This is an outpatient procedure. As I mentioned before, I've gotten a couple outpatient things done this summer myself and was very, very impressed every place I went with how careful people were and how cautious and how everybody had a mask, and everyone and all patients were required to have a mask to go into the facility. So just again, another encouragement. Next week, another topic, and we'll keep doing this until we get these curves back up and get caught up as a state. Let's go to the next slide. I just wanted to touch on this a little bit. We made a little chart for you to try to demonstrate the difference with flu season coming up, and reminder here to get your flu vaccine, about the difference between flu and COVID. And the problem is there's almost no difference between the flu and COVID. And so you are going to need medical attention. If you have symptoms, you are going to need a test. The test will be able to sort out between influenza virus and the coronavirus. And so the only things that really differentiate COVID is a lot more common to have shortness of breath if you don't already have lung issues, and that loss of taste or smell that's been reported a lot and now is one of the symptoms. So I think the takeaway message here is if you get a respiratory illness this fall, please get medical attention, please be evaluated, and of course online at the DOH website you can see where you can get evaluated, many places for a respiratory illness. And I think the last thing just to mention as well is that we are anticipating and hoping for a less severe flu season this year, because this will be the first flu season in a very, very long time that New Mexicans are all wearing masks. And so the masks will also help reduce the transmission of the influenza, so we're going to get a double benefit from those COVID-safe practices. Okay, now let's move on to our gating criteria segment. You can see that New Mexico remains yellow. The governor pointed out our lowest rolling 7-day average at 105. It works out that, if you have to squint, you'd have to probably touch your nose to your screen at home. But the third number from the right on the top is the cases per million per day. It's at 49. Now we had a higher count today, but when that number gets to 40, everything else staying equal, New Mexico should turn green again. Again, I just want to thank every New Mexican for all the hard work you've done to protect yourself, to protect your family, and thereby protect your community. So still doing well by a national standard. If you want to find somebody who's doing better at testing, you have to go all the way to West Virginia to see a state who has a lower test positivity rate. We continue to do very well in that, and so proud of that. And again, thanks to Secretary Kunkel and the governor for championing that for the last 184 days, relentlessly, I might add. Next slide. This is our gating criteria. We have all green except for one. We've slipped a little bit on testing. Believe it or not, this is the sum of a lot of small issues that came up, including weather and damage at Expo New Mexico and Albuquerque. Lots of different things contributing, less testing on the weekends. But actually, the number one driver is less public interest in getting tested. Now, I think that's going to pick up fairly dramatically as we get into cold and flu season here in another month. We're having our 2 days of winter now, but as cold weather comes more, we'll be looking at that and keeping you updated. But all in all, doing well, keeping our spread rate all-time low, daily cases doing very, very well, number of tests per day just below 5,000, test positivity best in the West, contact tracing very timely now, and that is working, and we're getting regular data about activities that in general that people have done before they get a COVID infection that can guide us. Similar things to what we've told you in the past: large gatherings, travel, indoor spaces without masks. And then hospitals are doing great. They every week report their all-time lowest number of cases. So just a couple more slides and we're done. We are looking at travel. We get this generic data from cell phones. We don't know whose cell phone is which, but we can monitor the amount of travel around the state. And you can see it started high, a severe drop when the pandemic came, hit a low point on Easter, and then gradually has gone back up. And I think if you look at the very end of the curve on the top, you can see that in the Northwest, there's been a steady increase in activity in anticipation of and during Labor Day weekend. You can also see in the Northeast, in the north part of the state, increase in Labor Day weekend traffic, and then maybe a drifting up. We want to, if that's Labor Day weekend, that's okay, it's over, there's nothing we can do about it. But it's just a reminder to stay at home, because those flat curves we had for 10 weeks are what helped bring the case numbers down and got us to the point that we're doing so well as we are today. So in closing, nothing about the virus has changed. That's a constant. My favorite analogy now is the on-off switch versus the dimmer. We're going slow and starting with low doses of reopening and gradually increasing so we can monitor our progress. And unfortunately, it takes 4 to 5 weeks to see the effects. So we'll know about Labor Day weekend. We'll know about school reopening in early October. But we still need to stay the course, still need to do what we're doing. You're only missing one gating criteria. And just thank you to New Mexicans for doing everything you've done to bring these numbers down. Please help us keep them down. I think the last slide just shows our behavioral health helpline. We are predicting a 15 to 20% increase in behavioral health issues and mental health issues. You are not alone. One of the most common things with people with depression and suicidal thoughts is feeling that they're alone and that no one cares and no one wants to help, and nothing they do can really make a difference with that. And that is not true. Pick up the phone, call that number. We're really here to help you. And with that, I'll turn it back to you, Governor.
All right. Thank you very much, Dr. Grace. And I really do appreciate that New Mexicans are making huge differences in our ability to get closer every single time we talk about where we are at having a new normal and getting more things open and recovering to the highest degree possible until there's a vaccine. And all of our success is really behavior by New Mexico residents. So I agree that it is, congratulations are in order. However, we can do better. And we've got to keep striving, because the better we do, and the more counties that get into that green zone that Secretary Stewart will talk about, the more we can do for in-person learning. And as New Mexicans will hear in this press conference, we are well aware that this virus is incredibly challenging and unfair, and that families with children have been really impacted in enormous ways, and their challenges are great. And our job is to mitigate those to the highest degree and to keep moving forward so that we're supporting families and essential workers and our children in as many different facets as we can. So we've started this week, as everyone knows, with some in-person learning, and I know Secretary Stewart's got some updates, and I give it to you, Secretary Stewart.
Thank you, Governor. Thank you, Dr. Scrace. It's been a long road since March 11th, when we had to initially close our school buildings back in the spring when we first saw cases. And so the fact that we're now here after Labor Day and starting to welcome students back in a very deliberate, safe manner is incredibly exciting, both for our students, families, and educators. And it's only a product of the fact that so many New Mexicans have done so much work to make sure that we can do this in a manner where the public health conditions allow for a safe reentry into the school buildings. So I'm going to give an update today on the progress that we've made in terms of preparing for a safe school reentry and some of the criteria and preparation. I'll talk a little bit again about some of the processes that we have for reentry in place. And again, we've set a very high bar for what it means to be able to bring students back into the hybrid model. So number one, you have to be meeting the statewide gating criteria, making sure that your county is in one of the green zones that Dr. Scrace referred to when we talk about test positivity rates below 5% and fewer than 8 per 100,000 in the average new daily case rates. So meeting both of those criteria and being back in the green zone, and that your school or district has had a public education department approved school plan that does focus on the instructional, socio-emotional, and family engagement and communication aspects of the reentry process. And finally, that the district or school does have the safety and support plans and materials in place, including any necessary upgrades to make sure that we've got the right facilities conditions, we've got the right air filtration conditions in schools, and those are components that we are making sure that every school has before we start bringing students back in for the reentry. So this week we're welcoming back nearly 50 schools and nearly 3,600 students to New Mexico schools for in-person learning for elementary students in the hybrid model. And what we will be doing at the Public Education Department is making sure that we are communicating out any relevant information about new daily cases as they come, doing that on a daily basis so the public will be able to transparently know the number of new school-related cases, the number of students and staff that were impacted, and how the districts and schools respond to that in terms of closure, cleaning, and then making sure that those individuals who were identified as close contacts are self-isolating as the school cleans and gets ready to reopen. You can go to the next slide, please. So in addition to that, we are really bringing in every resource from across the state to make sure that we get this right. New Mexico wants to be a model for how you reopen schools, how you keep schools open, how you contain any infection that happens. And so I want to thank the fire marshals from around the state who have been partnering with us. They've been going out and offering support to districts both around PPE usage and disposal, being able to provide guidance and support around the social distancing requirements and being able to give tips and strategies where that's helpful, and also being able to look at facilities conditions and, again, provide support to school districts around the state. So we want to thank the fire marshals who have been out into the 20 school districts and the charter schools that have opened up this week, and we are continuing that partnership as more and more schools and districts get ready to reopen. In addition, the Public Education Department leadership team will also be going around the state, both to micro districts who will have eligibility to have additional students in a 5-to-1 ratio to make sure, again, that those plans are in place and we're able to support those districts. And then also, as other districts and charter schools are reopening, being able to touch base with them so we can make sure that we're able to provide all the supports necessary for a strong reentry. In addition to that, we want to make sure that we're getting direct feedback, both from families, from teachers, and from other stakeholders as we're reopening. So next week, we're launching our focus groups. We'll be having our Teacher Talk Tuesdays and our Friends and Family Fridays. And so this is going to be another direct way where we can get information on how the reopening is going across the state, where there's room for improvement, and where there's other ways that the public education department can make sure that we're being supportive of all of the stakeholders to make this a very successful reentry. So when it comes to rapid response and school safety, as I said before, we're setting a very high bar and making sure that we're pulling out all the stops so that our educators, our students, and our families can have confidence in the preparations that have been made to bring your students back safely. So that includes expanding our surveillance testing program. We want to make testing resources available to all educators across the state on an ongoing basis. We'll be testing 5% of school staffs a week as they return back into the hybrid model. We know that was something that was very important for our educators to have access to. So we want to thank the Department of Health for working with us to make sure that we are able to provide access to those resources out to all of our educators. In addition, we've been working very closely with multiple departments, especially our Department of Health, on the rapid response protocols. The Public Education Department is taking a very active role to make sure that whenever a case appears in a school, that we're working within 4 hours with that school to identify those close contacts, to get information on where the infection happened, to give the school advice on closure procedures, quarantining procedures, and cleaning procedures, and to make sure that we've taken every possible step to contain the virus, contact those close contacts, and make sure that they're able to isolate so we can stop the spread of any virus right where it starts. In addition, we've delivered out hundreds of thousands of masks across the state. We'll be delivering hundreds of thousands more this week and next week, and we'll have a million more that will go out over the course of the month across the state. So every single educator, every single student should know that we've worked with our Department of Homeland Security and Emergency Management, FEMA, and also the Federal Health and Human Services Department to make sure that we're able to ensure that is not a barrier for any student or for any educator to make sure that they can have both a safe and high-quality learning experience. As I mentioned earlier, we'll be reporting these cases daily on our website, and that will be available to the public. And you can see the link that we have here at the bit.ly at Safe Schools NM for additional resources around how we can support safe and healthy schools as we return. From the Public Education Department, we are actively working with our schools and districts, both on the planning process, the PPE distribution and tracking. We're going to make sure that there's always a plentiful supply of PPE and cleaning supplies at all of our schools. And we're also going to make sure that we're taking an active role if we do see areas where it's not living up to the standards that we've set for safety and health, that we're responding right away to support the district and support the charter school to fix that problem and to provide follow-up enforcement where necessary to make sure that all of our students are taken care of. So additional PED supports that we encourage all of our educators to take advantage of. We just had a very successful launch of our Canvas 101. Canvas is our online learning management system. It's available to every single school district and every single charter school around the state. The state has made that available free of charge. And so we had our Canvas 101 to be able to explore that and have a strong start to your online learning classrooms. We also have our COVID safe practices training. We've had over 7,500 participants so far in our COVID safe practices training across the state and certification. And I encourage all of our educators to log on and take advantage of our Making Virtual Learning Accessible for All Learners, which we know is critically important as we think about equity and serving all students in a time where many of our students are still remote. And so we encourage all of our educators to go on our website, take advantage of this course. It's self-paced. You can do it asynchronously, and it's got great tips and strategies for how you can make your online learning very accessible. And I'm very excited, if you could go back to that slide, very excited to, we're going to launch very soon our family and parent workshops. Our family and parent workshops will be kicking off soon. They'll be in both English and Spanish, and they're going to focus on supporting children through the remote learning environment for families, also family wellness and self-care as you are working with your students at home. And I know that is something that many parents are looking for tips and strategies on how to manage that as kids are still at home waiting to go back in person. So stay on our website. Those will be launching here in the next few weeks. So just a couple of reminders, and I know I said this last time and I'll say it again. Getting this right means that we have to have everybody on board to make sure that the COVID safe practices that we've outlined for a safe school reentry are followed, that if you have or are experiencing any of the symptoms of COVID, that you stay home, that you make sure that you're taking advantage or that you're heeding all of the medical advice around keeping yourself safe, keeping your neighbors safe, and only coming back when you feel that you are completely free of those symptoms and you don't have fevers, you don't have cough, and you don't have symptoms. So please make sure that you are checking those every day. I know schools are checking those every day, and making sure that you're encouraging mask wearing both in and outside of school so that we can keep this virus contained and keep our schools open and safe. And finally, we know that there is no substitute for in-person learning. We want to maximize the amount of in-person learning that we're able to do in a very safe way. That's why we take the very deliberate approach that we have. We'll continue to assess and analyze that data on a bi-weekly basis around which counties are in the green zone, and we'll continue to welcome more and more students back onto campus as those public health conditions do allow for the return for students in the hybrid model. I want to say a very heartfelt thank you to all of the superintendents, to all of the teachers, to all of the school board members, to all of the custodians, the food service workers, counselors, social workers, so many bus drivers, so many roles that it takes to pull off a successful school reentry. We know that as we go back, there are still concerns that are out there, are still questions that are out there, and we're committed to making sure that we at the Public Education Department and in your local school districts are doing everything we can to address those questions, to continue to improve the process wherever there are areas where we can improve, and to make sure that you experience the return to in-person learning with the level of safety and the level of care that every single student deserves. So thank you to all of those who have just been moving mountains for the last 6 months to get us to this point. And I look forward to being able to continue to support you as we move forward on this journey. And with that, I'll stop and turn it back to the governor.
All right. Thank you, Secretary. I'm actually the navigator of this particular press conference because we really do want to focus on supporting New Mexico families as we have a return to a hybrid model in-person learning while we maintain distance learning and really work towards a successful school reentry program that's dynamic, comprehensive, and builds every week. And to do that effectively, we have to make sure that childcare continues to grow right along, both with our new educational opportunities and with any of the reopenings that we continue to try to work towards. We got to make sure that we've got childcare for our families. So with that, Secretary Goginski, who is the Secretary for the Early Childhood Education and Care Department, you're on.
Thank you, Governor, and thank you, Secretary Stewart and Secretary Grace. It is wonderful to be here today to talk about childcare in New Mexico. I also want to give a very heartfelt thank you to the thousands of early childhood professionals who've been working in our childcare facilities throughout the pandemic, meeting the needs of families and children, and really with their dedication and commitment, we've been able to keep childcare open and supporting our essential workers and businesses. So thanks to all of you for everything that you're doing every day for families, children, and communities. Thank you very much. As many of you know, the Early Childhood Education and Care Department was created last year in legislation, and we officially launched on July 1st, 2020. As you can imagine, this was a challenging time to launch a new cabinet agency, but throughout the pandemic, the governor's office, the other cabinet secretaries, and the staff in the department worked doubly hard to stand up this new department and meet the needs of children, families, and communities throughout our state. I'd like to talk first, beginning with Governor Lujan Grisham's first public health order. She recognized right away childcare was an essential service. And the majority of our New Mexico early childhood providers have remained open for business over the course of the public health emergency. I'm pleased to say that today over 75% of our licensed early childhood providers are open and serving children. But we know that given the fluctuations in families' employment and their concerns about health, that many providers are still facing significant challenges in terms of returning for enrollment, and some are still temporarily closed. We know that if providers are not open, that families will have fewer safe, nurturing, educational environments and places for their children to go. So for this reason, our department is singularly focused on a priority of helping providers remain open or safely reopen in a responsible way. Next slide, thanks. This week, we were really pleased to be able, let's see, is this, I can't see. Oh, sorry. Oh, this is the one. If you can go to the next. Okay, sorry. So, to the next, yeah. Are we on the? Thank you. Thank you, that's helpful. So we were really pleased this week to announce that we have waived parent co-payments for families who receive the Child Care Assistance Program for the months of September and October. The department will cover the revenues for our child care providers that they would have received from parent co-payments, and this will be included in their monthly reimbursement checks. By waiving parent co-payments, we're helping make it easier for families to afford child care while ensuring that providers continue to receive their revenues. Our department's decision to waive co-payments really follows earlier initiatives that we've taken since the beginning of the public health emergency to help support families and sustain New Mexico's early childhood child care industry. We've offered free child care to essential workers in the early months of the public health emergency, and we delivered wage incentives to over 3,000 early childhood professionals for 3 months, April through June. We also most recently have released the Child Care Stabilization and Recovery Grants, and over 500 child care providers have applied for this grant and will receive funding this month, again, to support them being strong and we continue to explore other additional financial incentives that we can do to make New Mexico's child care industry as strong as possible. Our partnerships have been enormous, and I want to thank Secretary Stewart for his leadership and partnership as we began to work over the last few months on school reopening, thinking about how are we going to connect families with child care providers and how are we going to help school districts really think strategically and innovatively about opportunities to expand child care access. So through the regional educational cooperatives, New Mexico's Child Care Resource and Referral Agency, and PED and ECECD, we have created infrastructure and supports that are allowing for us to expand temporarily childcare, whether it's through a satellite location in a community where a high-quality child care center can take their license and expand access in another facility in a community, or whether it's a family, friend, or neighbor who is available and willing and able to stay home and support child learning, the child supervision, and be that support to a family. We have set up the Family, Friend, and Neighbor Care Program. You can learn more about both of these programs at newmexicokids.org. We know that many of you may be wondering, am I eligible for child care assistance? And so we are so thrilled that Governor Lujan Grisham last year expanded eligibility to child care to up to 200% of the federal poverty level. So that translates to $52,400 for a family of 4. And we hope that all New Mexicans that believe that they are eligible, you're either working, you're in school, you need some type of financial assistance in paying for childcare, please reach out either online or through our phone number, 1-800-691-9067, and we will help you determine whether you're eligible, and if you are, connect you with a childcare provider that can help support you. Finally, I just want to talk about the commitment that we have had to health and safety. This industry has been tremendous. We, under the Governor's Economic Recovery Council, convened a COVID Safe Practices Subcommittee that was made up of medical experts, people from the Department of Health, and industry leaders, childcare industry leaders. And we developed some of the most clear and detailed and rigorous COVID Safe practices that, I mean, really in the nation. I think we are a model in many ways in the nation for what we have done for childcare and childcare employees. We have developed surveillance. We have 100% surveillance of our childcare employees. We did that initially. We're now focused similarly on these red, orange, and yellow counties. We have developed a rapid response protocol with the Department of Health that allows us to immediately take action, do the quarantine, do the self-isolation, and make sure that the staff and the children and families who are in those facilities feel safe and know that this is a place where they can get support, where they can learn, and we really want to encourage families to learn more about the COVID safe practices, to reach out if you have questions about that. And again, this is our commitment, that our child care programs in the state of New Mexico are safe, nurturing, healthy places for families and children to be. Final slide where you can learn more about our department, programs and services that are available to families, and also about this Family, Friend, and Neighbor program, which may be something that will help you as we all navigate and traverse this new period of the public health emergency. And back to you, Governor.
Right. I want to thank the secretaries today for providing up-to-date information to New Mexico families and New Mexicans. I do want to thank everyone. We do have very robust COVID safe practices. We're seeing them make a difference, as well as individuals' behaviors, which really work to combat this deadly virus, and we're all grateful for that. And New Mexico's in a very good place, which is why I'm hoping that we're going to continue in the next several weeks to talk about good news at every single one of our press conferences. One thing about the child care assistance is, while we are all proud of the fact that we took a leap of faith actually at that 200% of poverty, because we didn't have all of the funds allocated in the right places, and all the cabinet basically got together and figured out ways that we would leverage and make sure that we could cover that. It isn't enough. Raising a family of 4 on $52,000 we know is not enough, but and I do want New Mexicans to hear that. We are in a place of unprecedented economic insecurity as individuals and businesses, and looking at the national economic recovery. And we all need to be sensitive to that fact and to do everything in our power to, as quickly as we can, while being as safe as we can, get to the places where we know we're reinvesting in the economic well-being of every New Mexico family and business. And so thank you everyone for working so hard, and I hope everyone had a stay home, staycation, no large gatherings over Labor Day, and that we all did our part to keep New Mexicans safe. And with that, Nora, I am ready and available to take questions.
Thank you, Governor. We will start off by going to Matt Grubbs with New Mexico PBS. Matt, you are unmuted. Go right ahead.
To keep New Mexicans safe. And with that, Nora, I am ready and available to take questions.
Thank you, Governor. Matt, if you can hear me, if you can go ahead and mute your audio in the background, you can go right ahead.
Wonderful. Thanks. Yeah, just heard you. Governor, what are you looking at with respect to higher education? Are you just looking at numbers out of the state's colleges and universities? Are you speaking with folks to see what they're hearing anecdotally? Can you give us some idea of what that situation looks like?
Yeah, both, actually, Matt. It's a really important question as we're looking at what's going on in higher education around the country. We know that bringing students who are very mobile can drive places, who are, for the first time, maybe, if they're freshmen, leaving home and getting a little independence, that it's can be a breeding ground for high-risk issues and therefore COVID transmissions. I'm feeling really good about the coordination and effort by higher education, including, many New Mexicans may not know, but we treat the New Mexico Military Institute, because it's a college preparatory learning environment, as part of our higher education effort and one of our partners, and they've adopted all of our COVID safe practices and rapid response and surveillance and making sure that if we have an issue or an infection, that there's an immediate response to contain that outbreak. While we've had some cases, as you are well aware, both New Mexico State and UNM and at NIMI, we are, I think, in a really good place, and they're undertaking the same kind of hybrid models where there are clearly some in-person required educational aspects, laboratory and clinical aspects of education, and where they can, they are really promoting distance learning and engaging in what we believe so far to be pretty effective COVID-safe practices for living arrangements. So it's a bit of both. We require weekly reporting. We also get, every test and every positive case gets to the epidemiology department at the Department of Health, so we know what's going on in almost real time, 24-hour lags around the state, and I think that we're in a real good place. The lower the positivity rates are in the state, the better the outcomes are going to be at all of our institutions of higher education. And their willingness to deal with contact sports and delaying those and doing everything they can to limit sort of in-person contact at the universities, I think has really made a difference. And again, if we can control the spread of the virus, that gives them more opportunities to introduce more risk at appropriate times. But they're doing that, I believe, in full partnership with us, and I'm very pleased with where we currently are. Go ahead, Dr. Grace, I didn't see you.
Thanks, Governor. Just real briefly, Matt, because we've been so focused on education and both higher and K through 12, every time I see a report about a state where there's school reopening gone bad, I immediately go to COVID exit strategy or Johns Hopkins website and look at two numbers. One is the 7-day rolling average of cases per million and the test positivity rate. And in every single case that I've seen so far where this is happening, looking at the state level, the numbers are 3-4 times New Mexico's numbers. And so the governor touched on this with the positivity rate, but the better place the whole community is in, then the better any school reopening is going to go. And so I encourage people who are interested in numbers to try it, the next 4 or 5 articles you read, and see those case counts and see the test positivity rates, and then compare them to New Mexico at 49 cases per million and 2.1% test positivity.
Yeah, and I might just sort of add one more thing to Matt. You should expect that as we continue to focus on education and we talk about introducing risk, that there is likely, for us to be able to talk about additional enhancements and opportunities in higher education. In the same way, we're making sure that we're standing up and opening and increasing enrollment for childcare and early childhood education. And in the same way that we hope that we're going to be able to come about every couple of weeks and talk about how many more students are engaged in hybrid learning and how many more schools are added and how many more potentially age groups we can add to that dynamic. That's the goal. The goal isn't to just end here. The goal is to start here and keep building successfully so that in the next several months we are in a position to not have to roll back, to not have to have an environment where we are all struggling with incredible case spread and case counts, but rather we're managing and holding. And I'm feeling really good about that. One caveat, we don't know what the winter is going to bring. The scientific community and public health community is predicting, while what we're seeing in the southern hemisphere, we talked about that last week, Dr. Scrace talked about it again in his modeling, indicates that we should have a less severe flu season. And currently, our brand new, real double down effort at good public health practices, including mask wearing, will certainly assist in reducing the transmission of flu. There is still an expectation that we're going to see a resurgence of case spread with COVID, and that we should expect a difficult winter. So we take that very seriously, and we are treating this in that vein. We should expect that to occur. So how do we do it? The more we stay home, we socially distance, we wear masks, we wash our hands, we have hand sanitizer, the better able we can manage those unpredictable but potential, right, issues that are right around the corner. So again, I'm feeling really good. We refuse to be pessimistic, but we will be safe, practical, and pragmatic. But you should ask this question again, I think, even next week.
Thank you, Governor. Next, I'll go to Algernon Damassa with the Las Cruces Sun News. Algernon, you are unmuted. Go right ahead.
Thank you, Governor. Today you spoke to a House committee on the need for federal assistance to states and local governments. Also today, the U.S. Senate rejected a bill that was actually considerably smaller than the package of aid passed by the House back in May. So I'm just wondering, in terms of watching this process, is your administration thinking about how long New Mexico can go on providing the supports that it has before having to consider new cuts, perhaps another emergency session before the next winter? Are you thinking in terms of that timeline and what measures you might have to take and what you might have to cut first?
Of course, because that's definitely part of being right, practical and pragmatic. But I will repeat, and thank you for the question, when I talked to the Congressional Committee today in the hearing. The National Governors Association, the membership is every governor, so it's nonpartisan. And when we make policy requires requests, of the federal government or anyone else, or set a policy agenda, it is bipartisan then by nature, given the membership of the National Governors Association. The National Governors Association is asking for $500 million, billion dollars, in additional aid to the states. You had the chief of staff to President Trump, Mark Meadows, talk about up to about $270 billion potentially in additional aid as a negotiating item. And I'm not sure where that number came from, but here is the point. Universally, I think it is accepted that states need additional money, and we're going to keep fighting for getting additional money both to the state budgets and to our local government partners and into the hands of small businesses. But all of us have to prepare for an environment where, A, we may not get $500 billion, and we may potentially not get any additional resources. So we knew going into the special session that that was a possibility. And in that possibility, as you are aware, we held our reserves right at a certain level, certainly not as high as we'd like it to be, but about 10%. And we tightened our belts going into FY21 and preparing for the deficits in FY22. So the fiscal year, the budget that we will undertake in the next regular session of the legislature, which starts in January of 21. So today, I don't think we need a special session to deal with that. Today, I am certainly cognizant of an additional $2 billion hole that we could be potentially facing in the state. We've asked all of state government to contemplate in their budget requests about a 5% reduction. We still have a hiring freeze. We had about 4,000 vacant positions. We are looking very diligently at ways to leverage and to go after other federal revenues and grants. And while some of them have been very small, 100,000, 200,000, we are definitely continue to successfully go after those so that we can support the state to the highest degree possible. I'm not expecting in the near term or before January massive layoffs in state government because the legislature did an effective job with us in the special session. But it's premature. So here's the best answer. If we continue to reduce the rate of infection and to keep our positivity rates low, it gives us meaningful opportunities to continue to gradually, the dimmer switch, reopen, which means we mitigate the economic issues and losses going into the next fiscal year. So I appreciate the question, and we are aware of the risks, but I expect we're in the best position we can be in given the circumstances, and I'm still cautiously optimistic that something will emerge out of Congress. I don't think it's going to be the $500 billion that the governors have asked through the National Governors Association. But I think we will see additional votes on the matter between now and November, and I think we'll see some additional relief at about November. Yep.
Should I mention Medicaid?
Sure, we can talk about Medicaid. Thank you.
Thanks, Governor. Matt, great question. I think since Medicaid is about 1/7 of the state's general fund budget, and the total Medicaid budget is actually the same size as the entire state budget, I just want to mention a couple things about that. There was some misinformation that came out, I think in the summer, suggesting that, in June, July, that actually that insurance companies were seeing a windfall because there'd been a big drop in utilization and people weren't getting services. And I've been showing some graphs to that effect the past couple of weeks. But it turns out that that has not been true in Medicaid, and that the ratio of the prevalence or your chances of having COVID if you live in a low income area are about 6 to 10 times higher than if you live in a high income area, which means that the costs that Medicaid is facing, because COVID is expensive to treat, often involves long hospitalization, ICU stay, and the like, is significantly higher. Add to the fact that New Mexico has the second or third lowest per capita income. 42% of our Medicaid, 42% of New Mexicans are covered by one or another of the various Medicaid programs. And we're seeing actually costs not dropping at all, but going up. We have gotten a 6.2% increase in the federal match for the Medicaid program, which it's a good match. But most economists now are looking at it and saying it really should be more like 12. And so we can, and I'm not saying anything to contradict the governor, but I think we're very earnest about budget cutting and getting more efficient and finding ways to do things electronically, particularly in the Human Services Department, than we've ever done before. But there isn't a way to cut ourselves to the amount of money that we need. And we think that additional federal relief is going to have to be a solution, not just for New Mexico, but any other state that has a predominance of, like we do, of low-income individuals. Thank you.
Well, I'm going to contradict the Secretary. I said that I was expecting federal relief. I don't disagree. And right after the 2008 recession, in fact, Congress did get to a 12% match rate, increased FMAP, so that you could manage the increased healthcare costs related to folks losing their insurance and then having to delay healthcare. There's a ton of stuff that needs to be addressed. Again, I feel confident because you've got a bipartisan Governors Association working on these issues. Every mayor every county commission, everyone in the United States is saying to Congress that it's not enough. You're going to have to do more. The question is going to be how much more and whose bill is going to, reign supreme and garner enough votes in about that November timeframe. I do expect that when we go to the legislature, we will continue to have to look at ways to tighten our belts, and I have no doubt that we're going to have to look for innovative ways to increase economic activity, and I'll make a plug. Recreational cannabis is one of those areas where that's $100 million, and it doesn't fix it, but it plugs one of those holes, potentially would be enough to do a whole lot in the Medicaid gaps. So we are well aware, and I appreciate that you gave some time to talk about the fact that every state, including New Mexico, has economic challenges that we must get addressed.
Thank you, Governor. Next, I'll go to Dan Boyd with the Albuquerque Journal. Dan, you are unmuted. Go right ahead.
Yes, good afternoon, and thanks for the opportunity. Wanted to ask, it's been nearly 2 weeks since the public health order was revised and restaurants were allowed to resume indoor dining. Wanted to see kind of what signs or evidence there's been so far on how that's going, including kind of some of the rapid response data that's been discussed at previous news conferences.
Thank you very much, Dan. I think it's going really well. And I think it's both things. I think restaurants are working incredibly hard to be successful, and I want to be cautious. That is not an effort to say they weren't doing it well before. I was really clear that by and large, people brought COVID to restaurants and created that rate of infection. And again, if you're indoors, you don't have the right ventilation, people can't wear masks because they're eating, and you've got long duration, it's high risk. I'm seeing data that indicates it's going very well, and we need that to be the indicator. So last week, we had 20 rapid responses involving restaurants. This week, we have 10. We also have a general decline in rapid responses from 235 businesses to 163. So we're seeing a decline, right, in what's occurring in terms of having to respond to a business or organization or restaurant that has an infection or an outbreak that requires us to either go in, shut down, or reevaluate their COVID-safe practices. And this is exactly what we need to be seeing, because it's really cold in New Mexico right now, and it is not sustainable to continue to provide dining and restaurant services outside. And hats off to every local community who figured out ways to extend permits to allow that every restaurant owner who had the opportunity to provide additional food services in their parking lots, on sidewalks, spilling over into parking areas in streets. They did a really incredible job. But the colder it gets and the more winter weather we have, they aren't going to be able to sustain that. So we have to find a successful model that's in-person dining. So far, data looks good. And how do we keep that looking good? New Mexicans have to double down on mask wearing and other public health safeguards that allow us to manage the virus effectively. But so far, so good.
Thank you, Governor. Next, we'll go to Chris McKee with KRQE. Chris, you are unmuted. Go right ahead.
Thank you very much. I just had a question related to contact tracing, or a couple. One, are you seeing any benefit so far from that ad campaign saying, answer the call? Also, people who use iPhones may see in their new settings tab with the latest update, there is an exposure notifications sort of setting related menu. As I understand, it is incumbent on states to utilize that sort of new avenue. Is New Mexico close towards using that? I would imagine it somewhat might work like the Amber Alerts we all get on our phones at times, but I imagine it's somewhat different. Is New Mexico close to using that sort of exposure notification programming built into smartphones like the iPhone?
Answer for you about whether we're close. I am interested in every single tool in the toolbox. the more automated our information is, the more personal responsibility opportunities by individuals to help us by telling us where they think they might have been, what a contact or an exposure can look like, then the quicker we can get folks identified, tested, and isolated if necessary. That's the way in which we minimize the potential for spread and an outbreak. So the easy answer for me is as quickly as we can launch any successful tool, we should. We have not talked about recommending whether that should be one of the key things that we add, but I can't right this minute identify a reason why we wouldn't. And the other, I do think the ad is having an impact. I think it's a little too early to tell whether it's sustainable, but you can see that we're meeting our gating criteria, which means folks are answering their phones and we're getting to them faster. And I think that these press conferences where you're writing about this is also making a difference. We want folks to feel confident that we will keep their information private and confidential, that we are working really hard to make sure that they're safe, that their families are safe, and that we mitigate spread. And the only way any of this works is if we're collecting and gathering information timely, and that there's real confidence in our ability to do that. And so I can't give you that we've seen an increase and our time frame is being reduced and it's directly related to that ad campaign, but it certainly appears that all these things are working in concert to give us the kinds of improvements that we need. So what you really did is gave me another unabashed opportunity to promote that we need New Mexicans to answer their phones and to be interested in every smartphone tool that we have available to us. And I know that Dr. Scrace might do this, and it's not directly related, but early in this pandemic around the country, hospitals that were working, that were minimizing their outbreaks and infections inside hospitals was directly related to using apps and online tools for self-reporting, self-analysis, symptom checks, and to really make sure that you could uphold your own personal responsibility by going through a checklist about what you've done, where you've been, and when was the last time you had your temperature, et cetera, taken. And we know that those vehicles work, not directly contact tracing, but related in that we're asking people to participate in delivering information that helps us keep New Mexico safe.
Yeah, thanks, Governor. I was just going to add that on the modeling team website on DOH, Chris, you can find additional information. There's a weekly update that we go through, and now there's a standard slide about what we're finding out from contact tracing. So travel up a little bit, back up to about 15% of cases. New cases identify that they had recently traveled. Number 2 is just other larger gatherings at 7.5%. But you can see those reports there and review them every week. So they're out there. And I'm with the governor that anything we could do to automate these processes is going to help us fight the pandemic. And we're working really hard in almost every area. We'll look in more about the iPhone app. Sometimes those interfaces may not work particularly well with existing state government systems, but we'll take a look.
Thank you, Dr. Scrace. Next question, Nora.
Thank you, Governor. Next, I'll go to Julia Goldberg with the Santa Fe Reporter. Julia, you are unmuted. Go right ahead.
Thank you, Nora. Thank you, Governor. Governor, I wondered if you might provide an update information on Secretary Kunkel's retirement and the search for a new health secretary, which I assume is still happening, as well as any other information on Department of Health staffing. I noted over the summer there were several epidemiology positions open. I wasn't sure if they were new positions. So anything you could provide about that would be appreciated. Thank you so much.
Sure, Julia. So I can tell you unequivocally that our team is missing Secretary Kunkel. And I also want to just again publicly thank her. It is dealing with public health issues and certainly in terms of employees and breadth of responsibility, it is a very difficult and complex department to lead and run and support, and she did an amazing job, as well as all of the public health teams, because as we know around the country, we weren't investing in public health, and our state, certainly in that austerity environment in the last administration, there were very little enhancements or investments in our public health operations, and that proved, not just here, but in every state, to be incredibly challenging, which means that everyone has to do more, and she certainly did that, and we will be forever grateful and impressed with her leadership in that regard. And I'm sad that she has retired, but also really glad that we were able to, I don't know, that was really sweet talking. We got her to stay an extra year and brought her out of retirement to do that. Your point was really, where are we in identifying new leadership? We have interviewed several incredible candidates. This is a department that, particularly in the middle of the pandemic, is a tough challenge for folks to accept. And I'm going to keep looking. So we have made an offer. But we do not have someone who's accepted that particular position, and I hope to do that sooner rather than later. I'm going to give a shout out to the acting, who I've been treating as the acting secretary, and that is Deputy Secretary Mr. Billy Jimenez. So I don't want anyone to think that that day-to-day leadership is missing in that department. The epidemiology department, we also had a retirement, and so we need to get that position filled. And I believe we've brought on an additional epidemiologist also recently from UNM. So maybe this is another way for me, unabashed, to take this as an opportunity. New Mexicans, if we have individuals with the experience and desire to run the Department of Health, we're interested in hearing from you. If we have public health expertise in the state at any of the universities or at the medical school, and we've got nurses, doctors, epidemiologists, public health experts, virologists, infectious disease experts who are interested in coming to work for the state of New Mexico, you're again balanced with our hiring freeze, but in our high-risk, necessary, required positions, we invite you to get in touch with us immediately, because we need you, we want you, and yes, it will be an incredibly rewarding and incredibly challenging job. But I'm proud of that department and the work that they've done from beginning to end in these 6 months dealing with this pandemic. But I am sorry to report that we don't have a secretary that is eminently starting at the Department of Health. One last thing about that, for New Mexicans to have complete confidence in how we do things. Everyone is aiding and supporting the Department of Health. That means Dr. Scrace is involved with the Department of Health, frankly, every day. The governor's office is involved, making sure that we're removing barriers and providing resources and identifying strategies and reaching out to the private sector. That's why I've been more directly involved in making sure that supplies for testing continue to come into the state. Everybody has a role, even with the secretary, to make sure that we're only as strong as our weakest link. This is a cabinet that works together and leverages, and we're going to continue to do that. And it's a great place for me to thank the cabinet for their incredible COVID work, and to thank again the Matt and Dr. Scrace for his leadership in this regard.
Yeah, and one last thing, Julia, thanks for that question. You were referring to Mike Landon's departure, who was the director of our epidemiologic response division. They have hired his replacement. Her name is Christine Ross. She comes to us from the CDC, has experience with epidemics, also has worked at the CDC managing, they manage worldwide infections and pandemics, and has worked and specifically focused on Ethiopia. She's here on October 3rd. Everyone in EPI is very excited to have her join them, and we're really looking forward to her also helping us in this effort.
Thank you, Governor and Secretary. Next, I'll go to Chris Keller with ABQ Business First. Chris, you are unmuted. Go right ahead.
Hey, good evening. Thank you for taking my question. Dana from the Journal kind of echoed what I was going to ask. I was just wondering if there's any carrots that you were prepared to extend to state residents about restrictions that could be eased when the current public health order expires next week. Or in your mind, is in-person schooling and really ramping up and allowing more of that the main focus and priority right now?
I want to reiterate that education is absolutely the priority. I mean, we can't successfully even do some of the reopening without dealing with both childcare and educational issues that families are incredibly challenged by. Here's maybe the nugget. There are several things that people could look to in the Phase 1B and Phase 2 reopening that you should review those, and we will be looking at those again Monday and Tuesday to see where we are. And maybe, although the Matt and my team might, I get grounded for this kind of stuff, so good for you for putting me on the spot. An area of a great concern, and that we believe that we're in a position to really look at the COVID safe practices are effective, what we've learned in our school reopening, hybrid model, K through 5, what we know now from childcare successes. We think that there's an opportunity to again review some of the youth sports and training for some of our kiddos around the state. So look to see where we go with that. But again, focus is on education, #1 priority, because if we do that successfully, then we know we can do more business openings, and that's really important both to the state. So I probably maybe gave away too much already, but I do want New Mexicans who are writing to us, giving us their own data sets. I have to actually, which is a bit unfair, do that. There was I might need some help, Tripp or Nora. I can't remember if it was a New York Times article or which national media outlet that did a story about how governors make decisions. We've been very clear with you and New Mexicans that we do not make political decisions. The virus doesn't care what your political affiliation is. It doesn't care about your politics. It doesn't care how old you are. It is an equal opportunist virus, as most viruses are. So we use data and science and modeling to figure out how much risk we can introduce, where and why. And we have robust discussions, rarely debates because we're following the science, but we make sure that we all understand and we're clear that we have an opportunity to introduce risk and what we are introducing, right? What are the outcomes? Well, education, child care support, the economic recovery, putting people back to work. So we analyze each of those. New Mexico was not identified as a state that had clear evidence that was political. So why do I say that? Because New Mexico residents and advocates in their communications with the Office of the Governor or me directly, a shout out to New Mexico. They are largely accompanied. I wish you would look at X. Here's data that I've collected from these websites and these states and this CDC briefing, and I'm very impressed that we are working, all of us, it appears to me, diligently to apply public health, sound scientific data to the issues that we would like to see addressed. So New Mexico, keep that up. It's very helpful, and we've gotten a lot of information about what we might do with some youth sports and training. And so I'm interested in having the Matt give me their recommendation early next week.
Thank you, Governor. Next, I'll go to Brandon Evans with KOAT. Brandon, you're unmuted. Go right ahead.
Thank you, Governor. Thank you, Secretaries. My question kind of springboards off of the one you just answered when you talked about education being the priority, when we talk about the next steps. You did tease a little bit about the possibility of youth sports coming back after the next health order, but if you could maybe list of a couple of things here when we talk about what could possibly be next, and maybe talk about which ones are likely to happen next and which ones are probably further down the road, just from a handful of things when we're talking about opening campgrounds or movie theaters, further opening restaurants, entertainment venues, further lifting travel quarantines. If you had to rank those 4 or 5 things right there, could you maybe estimate, if we continue on the same line with the numbers that we are, which ones would likely happen first and which ones would likely happen last? Thank you.
All right, so your question, you should have gotten yours earlier in the queue because I can see the trend here, and I'm actually going to take another opportunity, which was not your question. Sometimes in these press conferences, when I identify that there are areas that we are looking at the data, robustly having conversations, rarely do we have debates, right? Because the science is not debatable. We just look at what the risk looks like. It becomes all of a sudden, and you didn't do this, but an invitation for everyone. Everything's going to be open. It'll happen next week, and people start well earlier than changes to a public health order occur. And I still see folks, and I know we all do, or we all might have a family member, right, that is posting on social media their most recent trip to Disneyland. And I will bet before that may not have followed the quarantine requirement upon their return. And so I really want to be cautious. These are not open invitations for anyone to be doing anything differently. And even when we ease restrictions, and we have in both the quarantine, travel, lodging, in-person dining, went to the hybrid model for education. They are not invitations for New Mexicans to ignore a stay-at-home order, right? We're under a public health environment that says you should only be going out when necessary, work, groceries, medicine, healthcare. And we know that there are other activities that we need. And quite frankly, we've also talked about COVID fatigue, where there are real behavioral health issues, including depression from a feeling of isolation and restlessness and not being in the normal environment, right, that any of us were used to, right? Getting up and going to work every day, as an example. Instead, we're all telecommuting from home. I do want, to your question, New Mexicans to feel like I do see a time where we can go to a movie, we could go to a bar or a nightclub, we could go to a concert. Likely those kinds of activities aren't going to happen until there's a vaccine. Now, it is possible, I suppose, that the medical advisory team and Dr. Grace, that our rate of infection will be so low that those are risks, as long as people are wearing masks and we can do some socially distancing, that we might be able to look at that differently. But I think by and large, New Mexicans should expect that those are at the end of that reopening spectrum. The things that we can continue to build is increasing capacity for tourism, increasing then capacity for in-room dining, increasing capacity for the hospitality industry, looking at conditioning, increasing retail capacity, increasing capacity for sports, and as you said, camping and outdoor activities. Those are things where we have tools that readily mitigate spread because you can wear a mask, you can socially distance. Indoor dining's the hard one, but we're going to create an environment where it's safe as possible. So I think those are the basic areas. We're going to try to get more in-person learning, more childcare up, and we're going to work to increase the capacities, right, in a variety of places. And as we do that, also, I hope have an opportunity, because the data says that we can introduce new things like camping. So although given the weather conditions, we need to think about that. We might need to think about that as early as next week, again, if the data supports those decisions. So I know you want more specificity, but it depends. And the virus doesn't tell me what it's going to look like next week. And I can't quite predict, even though you've got some modeling about behaviors and traveling, hard to know what's happening around us, what's happening county to county, until we actually look at that 14-day or 7-day rolling average. Go ahead, Dr. Grace.
Yeah, I have only one little tiny thing to add, and that is just that it takes 4 or 5 weeks for us to really see the effect of the changes we've already made. And so it's really hard to rapid cycle through these things. Also, we purposely timed the public health order in the middle of the month rather than the end of the month, because it makes it much easier for the Human Services Department and all the the million New Mexicans who benefit from our programs to renew them. The federal government needs evidence of a renewed public health order to provide additional funding for all the waivers we've obtained to expand. So we're kind of moving to a mid-month cycle on the orders to expire, so we have that time to apply to the federal government, get that data in, and then get the additional funding for enhanced SNAP benefits or keeping people on the Medicaid program, et cetera.
Thank you, Governor. Next, we'll go to Nick Siebel with the Silver City Daily Press. Nick, you're unmuted. Go right ahead.
Thank you, Governor and cabinet members. I kind of want to go back to that first question about higher education. Obviously, in Silver City, the higher education is a big part of our community. A lot of the students that are at Western New Mexico University come from elsewhere. And my understanding is that students whose permanent residence is not in Grant County, if they test positive for the virus, they do not count in the county totals. So there's a lot of concern that I've heard from readers of the newspaper about that. And so I just want to get some clarity on how that works. To a lesser extent, also inmates at the county detention center, again, if they're not county residents, how does that work? And also, are those students in particular, does contact tracing, the other things that the state does around positive cases, that still happens, right? Even if they don't go on to our numbers. And so what would you say to residents with those concerns?
Well, a couple of things. I'll do the concerns, and we actually, and thank you for the question, a couple weeks ago talked about how we count out-of-state residents, and so I'll have Dr. Grace talk about that again. And remember, if you were tested here, it's a case that we count, but that gets reported to the Department of Health where your residence is. So I'll make sure that the Dr. Grace can go over that again. But when residents are concerned, I don't want unnecessary, none of us do, concern, but I actually appreciate that people are really thinking about how do we manage infections and how do we control to the highest degree possible the mitigation, right, of the spread of this virus. So I want to thank Grant County residents for talking to you and asking these questions. So first, yes, wherever you live, if you're here, we're going to do contact tracing and figure it out because you are here, right? That means I need to isolate you here and or quarantine you here. I need to make sure that I know what kind of contacts. And each of the higher education institutions, and Western's been an incredible leader, are already, right, they have to adhere to COVID safe practices. They had to identify COVID safe practices. They worked with us all summer to do that. And they're in constant contact with us about what's going on and how that is all operating from faculty to students. And Western's been a very effective, productive partner. And so I want to give confidence to Grant County residents and families that we're confident in the ability to contact trace, to isolate cases, to do surveillance and testing, and to continue to have a really strong partnership. You know, we've seen a real decline in detention centers, and that's the same issue. If you're residing in that detention center, but your state residence before that detention center is somewhere else, we're still counting you and watching you in that detention center and doing that surveillance. So none of that shifts in any context. We treat that, you're in the state, you're in Grant County. We have a responsibility to make sure that we're doing the contact tracing, the isolating, and the treatment all right where those cases reside. So I want to make sure that that folks in Silver City and Grant County are really clear about that. I do want to also offer this, that sometimes we'll have folks who will come into a community traveling or visiting a student, and we'll actually get rumors that they think that they're COVID positive or they had a positive test, but they didn't get the results until they came into the state. We still get some interesting hypothetical cases more often than not turn out to be false in terms of what's going on in a community, but I feel very confident, that we have a system that deals with those issues pretty productively. But Dr. Grace, you want to go over exactly how we do that one more time?
Yeah, the standard rule, and I'm going to check with epidemiology, and we'll get back to you, Nick, on this, is that out-of-state residents, an out-of-state resident gets a test in New Mexico, it's positive, they end up in the hospital, and we would count the test in New Mexico, the positive case would be referred to the home state. Hospitalization we count here because it affects our hospital capacity. I'm not sure that we accept that process for college students, but there's absolutely no question that, we mentioned this last week, that we want to get schools open and we want to keep them open. So if a school's in the green and they stray a little bit back into yellow, we don't want to close them down right away, and we look at those on a case-by-case basis. But our epidemiologists and the contact tracing process, they're the ones who find out the person's from out of state. We don't know that till we call them. They will, in their daily meetings, discuss trends, cases, outbreaks in different educational institutions, and they're working on that process to reevaluate every 2 weeks for a county that might go from green to red. How do we look at the data in real detail to make sure that this is a school-related thing that warrants closing the school? So I would say that team is totally all over that. I don't know exactly if there's an exception to counting college students in our numbers, but the epidemiologist, that division is completely aware of that and takes every case into consideration, in-state or out-of-state. Thanks.
Agreed.
Thank you, Governor and Secretary. Next, I'll go to Steve Edmondson with Socorro Community Radio. Steve, you are unmuted. Go right ahead and ask your question.
All right, thank you very much. I have two questions if I can get these in. One has to do with the testing. The New York Times ran a story last week about the cycle thresholds that are being used around the country in different states, and said most states were doing 37 to 40 cycles. And from what they said, a lot of the positives coming from that many cycles would very likely show people that are not really contagious. And I was just wondering if maybe you all can tell me what our cycle threshold is. The CDC is recommending 33 cycles. Now, the second question I have, Governor, I'd like to respectfully disagree with you about whether the virus discriminates against people. Those under 50 make up 69% of the cases in New Mexico. But those under the age of 50 and have no underlying medical conditions, only 0.07% have passed away. So my question is, should we be focusing less on the number of cases and more on who has the cases? Thank you very much.
Yeah, so I appreciate that disagreement. And what I mean is, doesn't matter how old you are, we've had infants with COVID. The ability to catch COVID has nothing to do with your age. How you fare with COVID has everything to do with underlying conditions and often, right, the age issues related to those underlying conditions. But there are plenty of anomalies, and remember that whoever you are and whatever age you are, you have the ability to give it to somebody else. And that becomes a chronic care issue or a life-threatening issue for far too many individuals. And certainly, given the mortality rates of this country, certainly something that we should continue to be incredibly vigilant about and work to every day. Again, my North Star is saving as many lives as I can in New Mexico. And that ought to be how we treat this virus in every context. And again, we're still collecting data about a novel, a new virus, about exactly what the long-term effects are and aren't for many populations, and including many younger individuals who have contracted the virus. I hope that we don't continue continue to see the kind of particular problems, including a case where a woman now is diabetic with glaucoma in the country related to COVID-19 issues. So I keep hoping that we're not going to find out more damaging healthcare information related to COVID, but given the science now about how it attacks different areas of our body, I think it's incredibly challenging to really know just how devastating the personal and public health impacts are going to be. Dr. Scrace, let's talk about the cycles for testing.
Yeah, that came up last week. Thank you, Governor. And I was in conversations with the folks over at Tricor and our state lab about it. They say the vast majority of folks who are tested positive in New Mexico have a CT score of 33 or less, so that conforms to the New York Times guidelines. So we're all over that, and it kind of gets back to what I was saying earlier about the incredibly high quality of the testing and the fact that New Mexico is not overrun with 30 different kinds of COVID tests, some of which are highly reliable and some of which aren't. We've kind of stayed in the high reliability lane on this, and our lab folks are very on top of it. So I have an email here that I could try to explain to you, but I'm not sure that I could effectively do that. But I think the answer to your question is that we're well over 90% of positive folks in New Mexico have CTs of 33.
Thank you, Governor and Secretary. Next we're almost done here, just a couple more questions. Next we'll go to Bonnie Gordon with the Los Alamos Daily Post. Bonnie, you're unmuted. Go right ahead.
Folks are very on top of it. So
Bonnie, if you could turn the audio down in the background. Thanks so much.
I just did. Yes, as the governor pointed out, winter is coming, and I would like to know what the data says about COVID and colder weather.
All right, Bonnie, I'm going to actually do the same thing. I'm the quarterback. I'm going to pass the football over to Dr. Scrace. There was an interesting, and I think it was actually on one of the morning news shows where they're really trying to get their arms around. So we thought the virus was going to be more problematic in humid, hotter weather, given these issues, its ability to live longer, as an example, on surfaces. Then there was sort of, so that we should expect better results potentially in the winter months. Now, I'm not sure that there's any evidence to support that, given that there's a diminishing rate of infection related issues if it's colder and drier. But I will defer to see if there's anything more than kind of an anecdotal discussion that I certainly caught this morning, because as we get closer to real winter, I feel like we're talking in Game of Thrones kind of aspects here. Winter is coming. The CDC, because this is when flu season is typically bad, I think we're all preparing that the virus isn't gone, we don't have a vaccine, and this notion that we can have false security about any of it is wrong. We have to be vigilant, smart, prudent, and we have to keep our guard up are the best ways to deal with this public health issue. But Dr. Scrace, any emerging evidence that gives us a sense about weather and this novel virus?
Yes, thanks, Governor. We've been watching the medical literature and focusing on the other countries who've been through the pandemic. Remember, it did start in the winter in China, and the evidence is conflicting. In Brazil, the higher the temperature and the higher the humidity, the higher the transmission. In Saudi Arabia, for example, the lower the temperature or the lower the humidity, the greater the transmission. Now, I can't imagine the winter in Saudi Arabia gets very cold, but we're watching that, and it's hard. It really is hard to predict, and some of that is, it's the first cycle of the pandemic through the year, so it kind of operates independent of the weather in general. It's spreading from people who have the virus to people who are not immune to it, and so. But we don't have a consistent direction one way or another. There's several papers from China, for example, that show case counts decline as the weather gets warmer, but They got their pandemic in January. It ran through the population and started to decline. And so we can see these correlations, but they're not the same as causation. So there's no good evidence yet that warmer or colder weather makes things better or worse. We are hoping we get more out of the Southern Hemisphere in the next couple months, though. Thank you.
Thank you, Dr. Scrace.
Governor and Secretary, and we'll end with Jens Gould from the Santa Fe New Mexican. Jens, you're unmuted. Go right ahead.
Hi, Governor. Hi, Secretaries. Thanks for having me. I had a couple questions that were already asked, so I'll ask this one. Governor, I wanted to go back to what you said today in the House hearing and some of the comments you made earlier in the press conference about the budget deficit. Some of the comments you made to the House were pretty dire in terms of the budget situation. And I was curious to know if the state doesn't get additional aid from the federal government, could it need to reduce cash reserves down to zero in the next session? I mean, they're currently expected to drop to around 11%, which you mentioned. Could they have to go to zero in order to patch the budget gap? Or could that not even be enough, even if the agencies cut 5%? I'm curious what you think the remedy will need to be in the session. And I know it's still a few months away, but curious your thoughts on that. Thank you.
Jens, they are fair questions, and certainly the LFC continues to meet and should, and we continue with the Department of Finance and our Tax and Revenue Department to really pay attention to those projections. I want to go back to the hearing where an economist was talking about our FY20 end. It wasn't as bad as we thought, so that the states, including New Mexico, where we're projecting another $2 billion hit that we're going to have to figure out, and we don't have $2 billion in our reserves, that becomes quite challenging, because you either have to drastically reduce your expenses, which means drastically reducing our direct services, police, public safety, healthcare, Medicaid, childcare, education, et cetera, or you have to identify new revenue into the state. It's a really hard situation. I don't want to, and we won't. Can't candy coat it for the federal government or anyone else. Look, we have a fiscal calamity completely tied to the virus. This is a virus that we could have managed as a country far better, and the Democratic governors in that hearing today made that case, that the federal government still doesn't have a cohesive strategy, which is why you've got 5 states that are allowing in-person education and going to local school districts in different ways, but don't have any standard COVID-safe practices, where we've had most of the states are still bruised red in terms of opening. We continue to see spread. And when you see spread anywhere, when I see it anywhere in the country, I know we're still at risk, because it's not being managed, and it just moves with people. So I am incredibly cognizant and concerned. So I have a two-part job here. I have to think about ways not to take reserves to zero. I don't know what the possibilities are, but I feel really compelled, particularly as a governor that got it to nearly 25%, so record reserves. I know how valuable and important it is, because emergencies occur in any number of contexts. Just the flooding and the wind damage to this winter storm is another issue that costs incredible resources by both public and private sector responsible parties. So you need money in an emergency account, you need a reserve, and our bond rating gets greatly reduced, which means we can't borrow money, we can't invest in infrastructure, we can't do any number of things that government has a responsibility to be doing. So long answer to tell you, I am hopeful that we can continue to reopen the economy, that we can successfully deal with education, that I'm not going to have to ask the legislature to take reserves to zero, that we'll have mechanisms to bring additional revenue into the state, and that the federal government will, in fact, at some point, come together on a package That may not be the $500 billion or the $3.5 trillion package that the House, which included the $500 billion for states, that came out of the HEROES Act in the House, but won't be what was termed the skinny bill out of the Senate, which didn't pass today because it didn't really create any relief for the states. I think somewhere is going to be a sweet spot, and honestly, it's too early to tell you what that is. But I do want New Mexicans to know that the state works diligently with the legislature, and particularly right now with the Legislative Finance Committee, to identify every single strategy, including continuing to tighten our belts and to continue to try to invest in economic security in our local businesses, notwithstanding that we're still managing and fighting a deadly virus. So I can't be more specific than that. I think it's going to take that combination, and I am still expecting that we're going to get some combination. And when we have those numbers, we will absolutely be providing them to the public, and so will the legislature. And I want to thank the legislature. We don't always agree on a strategy or an evaluation, but we do work very well together, particularly when you look at what's going on in many states where the legislature and the executive branch really can't come together on solving some of these financial challenges related to addressing the pandemic. And the last thing, we still have expenses related to the pandemic. So we're going to be $100 million short in testing if the federal government doesn't do something. Secretary Stewart will tell you we're going to be short for PPE and testing and surveillance and rapid response and sanitation efforts and other strategies in public education. That what we need for distance learning, we're going to be short in public education. Secretary Gorginski will tell you. So we're still evaluating what those holes really are and what they'll look like. And it's just too premature to tell you, but I am hopeful that we don't have to find ourselves in that situation. But we do have a sizable budget deficit going into FY22. That is true. All right, New Mexico, thank you. Thank you for tuning in. Thank you for delivering on your hard work. Please keep wearing masks, socially distancing. We can do this. Remember, we're all in it together, all together, New Mexico. And again, stay safe and see you next week.